Okay, so hello everybody, welcome. Thank you so much for being here. I'm so excited to be here today for this webinar on pain and behavior in pet dogs. I think this is one of my most nerdiest topics right now. I'm so interested in this, and we're just so thrilled to have Dr. Rendon here to talk us through it. Maybe I'll start off by we can introduce ourselves and then we can dive straight in to the content that we're going to be delivering today. Any questions, feel free to pop them in the chat box. We'll do our best at the end to kind of go through them all. I will start off just myself. My name is Karishma Warr. My pronouns are they, them, and I am head of training and behavior at Canine Academy. So we are a group of multi-certified dog trainers. We specialize in virtual dog training. And we work a lot with complex cases with aggression, fear, anxiety in the urban environment. And we've been working some cases alongside Dr. Rendon, so that we've got together today to team up on this topic. We're absolutely thrilled to be joined by Dr. Rendon. Do you mind if I do a little intro and then hand it over to say hi? Okay, I'm going to do it. Dr. Rendon is fantastic. She's the medical director at the Williamsburg Veterinary Clinic in Brooklyn, New York. That's where our company was founded. So we have a lot of overlap in the community. And I'm just so excited because there's so much that I don't know and I want to know, and I have so many questions. So maybe just say a quick hello so everyone can see you, Dr. Rendon. Oh, I'm just going to unmute you. Give me 1 second. You'll have to actually unmute yourself, my love. Would you mind?
Unmute myself. There I am. So, and this is the first time that I've done a webinar, and so unmuting myself and things like that, I'm not that, I have to remember to do all of that, but I'm so thrilled to be here. I'm a general practitioner. I've been practicing for about 20 years, and I've been in Brooklyn for about 9 years. And so one of my interests has always been behavior. Actually, I don't think I mentioned this. You have a master's in brain and cognitive behavior, which I did before I became a vet. And so I do have a little bit of that background, which is nice and ties into what we'll be talking about today.
Yeah, I did not know that. That is amazing. So cool. I think that the intersection between behavior and medicine is so interesting. And so, yeah, we're definitely going to have a lot to cover today. And on that note, just a quick overview. We're really just going to split up our chat today into 4 topics. We're going to try to keep it simple, but I know me and Dr. Rendon are both so nerdy, you're probably going to just get swept away. But we're going to start off just talking a little bit about pain itself, like why are we talking about this? What are the effects of pain long term on a dog's body and behavior? And then we'll finish up with some more actionable chat. So how do we identify pain? What are we thinking about when looking at pain in dogs? And then what are the next steps when we do think that there is pain contributing or pain present? What do we do next? And we're going to be kind of looking through like a behavior lens and a medical lens, which I think would be really, really cool. So I guess we can dive straight in. I guess, Dr. Rendon, what springs to mind for you when we ask that question, like why talk about pain? What was it that made you interested in talking about this with us?
Because so much pain in animals can be unrecognized. And so it's a quality of life issue. And I think that's one of the big things that is, as a doctor and for you as a trainer, just making sure that our animals are living their best lives. And so if there's pain and it's impacting behavior, it's impacting their ability to enjoy life, then it's something that you want to be able to address. And so it's not something that everybody is aware of. And I feel like it's not uncommon for people to downplay it because animals tend to, they're nonverbal. And so they don't communicate pain the way we would communicate pain. I think even though they are nonverbal, they communicate to us through their behavior. And so part of it is recognizing what they're saying. And so being able to, really pay attention and hear what it is that they're trying to tell us.
Yeah, I completely agree. And especially that line that they're nonverbal and they're not going to say, ouch, this hurts. So we have to figure out what are they going to say and how they're going to say it. And I think that lots of folks hear about this conversation and they go, oh, but that doesn't really apply to my dog. My dog's a young dog or a healthy dog, or, I got them from breeder. They weren't a rescue dog, so they're very healthy and it's not going to apply to me. But I think that we're learning as pet professionals that there's actually so much more pain in pet dogs than we would have expected. Some of the things that I've been learning recently from you and studies that I've been reading has really been blowing my mind. And you've sort of laid out these different areas that there could be pain. And I was talking to you yesterday and saying I didn't even think about dental disease.
Right.
So do you have any idea about this question? Like, why is it more of a problem now, or seems to be more of a problem now?
I don't know if it's necessarily more of a problem, but I think it's something that we're just really starting to recognize. And I think that's true actually just across veterinary medicine. For years, there was kind of this attitude of, well, if they're not obviously in pain, then you don't really necessarily need to treat it. And in fact, for many years, when I first started practicing, it was starting to go away at that point. So but even as early as 20 years ago, people would say, oh, well, we don't want to treat pain because then they're going to be too active and hurt themselves more. And so that was actually a really common thing. If an animal was, showing limping, or there was something that was going on, there was actually a recommendation to not treat it because otherwise they were going to feel too good and exercise too much and then hurt themselves. So that's definitely been a shift in veterinary medicine, really recognizing that, that animals that are acting painful, they should be treated for that, but also that sometimes there are behaviors that don't look overtly painful, but they are. And so getting back to dental disease, I mean, that's one of the things to me that's really interesting, because dogs and cats often show no sign of dental pain. And I can have an animal come in and their mouth is rotting and they're still eating. They're still doing great. They just basically swallow their food. And owners are so, surprised to find out that, there's something that's going on. And the thing that's very rewarding is that once you take care of it and you address it, hearing from people over and over again, they're a new dog, they're a new cat, they're doing so much better. It really makes you realize how stoic some animals can be, and they'll just live through it. And that's, it's heartbreaking to think about how many animals are living in pain. And dental disease is just one of several things that could be. That's just one example.
Absolutely, 100%. And that line, like, they're a different dog now. I think that really, or a different animal now, that really just like speaks to how subtle but pervasive the changes can be. And I think that leads quite nicely to this little next point, a question that we had, and you are blowing my mind here with all of these words. So explain a little bit to me what untreated pain can do.
Yeah, so chronic pain, and we talk about acute pain versus chronic pain. And acute pain is what happens, immediately when there's some kind of injury. And that can be something that's relatively minor. It can be something that's, really big. But acute pain tends to be somewhat protective because it prevents you from continuing to do whatever it is that you're doing that's making it painful. And so there's a purpose to that, your response, to get away from whatever it is that's making you painful. Chronic pain is something that's lasting beyond when healing should have been finished, beyond what's necessary. And so chronic pain is something that is pathological, and is usually something, a disease state that hasn't been addressed. And so it's something that you'll have ongoing inflammatory changes. There's ongoing just a disease state in the body. So just to quickly go through these the terms that are up here, we have hyperalgesia. And I was saying, I don't want to get too wonky about this, but just to kind of give a sense of what chronic pain can lead to. So pain initially comes from the outside, and that little nerve signal goes up into your brain. That's what we consider the peripheral part of pain. And hyperalgesia happens when over time, if you have chronic pain, then what wouldn't normally be painful is felt as painful. So, or, you have like some little injury and your reaction to it is much, much greater. So, and sometimes people will say, oh, you're just being dramatic, or, to the dog, oh, don't be so dramatic. But it really is that their sensitivity is heightened. And so and that's all change at a physical level, where something that wasn't that painful is now incredibly painful. And then you can also have, with chronic pain, it can become something that's central. So from your spine, then that signal goes up into your brain, and things can change at the central level in your brain. And so there's something called allodynia, which is when you become painful to things that aren't generally painful. And so, if somebody is petting your back, that's something that doesn't typically cause pain. But if you have chronic pain and you have that chronic state, then things that wouldn't normally be painful are painful. And so, over time, this is something that can affect the entire body. There's changes to your molecular level, the cellular level. It's happening and changing your immune system, changing your ability to fight disease. So over time, it can definitely impact quality of life, and it can definitely impact your propensity for getting other diseases. And so, for our pets, it's, again, something that can be unrecognized. And so it's one of the reasons that it's good to try to look for it so that you can treat it.
100%. I mean, wow, it literally just changes the physiology of the dog.
It does, yeah.
Which is amazing, and such a strong argument for, pursuing treatment and for the importance of spreading the information. And I have actually had like the hyperalgesia experience after a chronic shoulder injury. So interesting to see that on screen here is something that, and then to be able to go, oh, actually it is real. And I was also called dramatic, and I was like, wow, okay, this makes sense. So it makes sense for me from a behavior perspective that we're seeing physiological changes, because we see a lot of behavioral changes. And it was interesting that you mentioned things that were not usually painful being painful. Well, a big red flag for me from a behavioral perspective are things like sensitivity to hot and cold.
Absolutely.
Wet, being nervous around water or avoiding puddles, being very sensitive to cold weather. My dog was really nervous about wind hitting his skin, and he had chronic skin issues. And it all makes so much sense when you think about thinking about that. But there are so many behavior problems that can also be impacted or just directly linked to the chronic pain that we're discussing. So because of those, I imagine some of those physiological changes, we can see anything from sound sensitivity to separation anxiety to issues with leash walking. I have just like so many cases where, we presented as an X behavior problem, and we worked on this behavior problem for a while and didn't see progress, and went to one vet, maybe two vets, maybe three vets, until we finally got to the bottom of a problem. And just one that we talked about yesterday was a case with a dog that was reluctant. It was labeled as stubborn. It was a very stubborn dog, and he would lay down and sit and not get up and refuse to do things that the guardians were asking. And we found that it had a bullet in its leg that needed a foreign object in its leg. And once we removed the foreign object and got him on pain management, the behavior went away. So interesting that we'll be looking at behavior problems. And this is often the thing that people come to me with, or to even you with, saying, my dog got this behavior problem. And we often have to go, okay, what's actually behind this? And I think that's what we can kind of dive into a little bit more here. We maybe talk a little bit more about the details of some of the behavioral indicators or the things we might be looking at. So maybe you could talk us through some of this obvious versus subtle distinction.
Yeah. And I think for the purposes of this particular webinar, when we see obvious signs of pain, I feel like those are the easy ones. You see limping, you see moaning, you see crying out in pain. Those are the types of things that, people often go to their vet, and it's pretty straightforward because there's a correlation. They're acting like what we would expect for them to act, to indicate that they're in pain. And so what we kind of want to talk about more are the much more subtle signs, that's the part that's so surprising, that there are so many dogs that will hide things, so many. And it's so heartbreaking, so many good dogs that they're not going to cry out, they're not going to act like they're painful, but there are changes in their behavior. And so the outline here, the maintenance of normal behavior, that's basically what you want, right? You want your animal to be acting normal every day, that they're eating the same, that their interest in playing is the same, that they really enjoy their walks, that their quality of life is good. So maintenance of normal behavior is exactly what you would hope for your animal. And so when you're trying to identify whether your animal is in pain, other than those really obvious signs, other things that you're going to look for would be loss of normal behavior. And so things like, are they not eating anymore? Is it surprising that all of a sudden they're not eating? Are they reluctant to jump on and off furniture? Are they reluctant to go for walks? Are they no longer playing? I think one of the interesting things about that is that people tend to think of those types of things occurring as animals get older, as a normal sign of aging, and where to some degree it can be true. And certainly dogs mature the way humans mature, and they're not always going to be like the rambunctious puppies that you expect them to be. Sometimes that kind of lessening of their affect can be from pain. And so that's one way you kind of gauge what's going on. But then the development of new behaviors is another way that you look. So all of a sudden, and so anything that's kind of a sudden change in their behavior should make you wonder, is there something else that's going on? I think aggression and irritability, people tend to wonder if that's what's going on. And certainly that should always be investigated. Even in younger dogs, I think with a lot of rescue dogs, where the background is unknown, we don't really know where they've come from. And if they're aggressive, a lot of times it's easy to say, oh, well, they're traumatized, they have all these other things that are going on, but their history is unknown enough, kind of like your example with the dog with the bullet. You don't really know what's going on. And so it's possible that that aggression is really because of some previous, injury or something that's happened that is now carrying over, and they continue to show that aggressive behavior, basically that aggressive protective behavior. They're trying to prevent themselves from having more pain. Other, more subtle things would be just anxiety, just not wanting to be in a world that could potentially make them more painful. And so the shaking that we see, the trembling, attention seeking. So dogs that are clingy, if that's a change in their behavior, I think a lot of us have clingy dogs, as my dog is over here glued to my side. But, when that's a change, when before they were relatively okay to, hang out in the chair by themselves, and now they're always with you, that can be a sign that there's something that's going on. And then, over grooming, that's something that can overlap with allergies and can overlap with other things, but it should definitely be investigated as, are they over grooming? Are they licking their paws? Are they looking at their joints? Are they looking at their belly because they're painful? And so one of the things I think that kept coming up in the question section is, are there behaviors that correspond to specific types of pain? And really the answer is yes and no. One of the things about pain, it's a very complex topic. So not only is it physical, but it's also emotional. And animals will express their pain in completely different ways. So it's a very individual response. And so, unfortunately, there's not something as simple as, oh, the dog that has dental disease is not eating. Or becomes, more aggressive. It doesn't tend to be that simple, even though there may be some correlations. I think the paper that we were reading, there are some dogs that will do what's called stargazing, where they're kind of spacing out and not really engaged with their world. And there's a possibility that could be gastrointestinal pain. So things like that. But unfortunately, there's not really it's not a very clear correlation between the types of behaviors and the types of pain.
Yeah, I definitely, like, anecdotally have a similar experience where you'll see dogs that might have a very similar diagnosis, but expressing that pain in two totally different ways. So I have just like two case studies from my own house. We have a rescue dog from Romania who has luxating patella in both of her back legs, and my own poodle has similar patella issues. And when his is flaring up, he becomes extremely sound sensitive and will bark at any noise in the house, but is absolutely happy with being cuddled and kissed and can sleep in the same bed as me. The Romanian rescue, when she is experiencing flare-ups, she becomes extremely I guess irritable, aggressive around people moving around her. No sound sensitivity, so it's like the flip. And it's essentially the same problem, but just comes in two completely different ways. And so I think that's often part of the art of it, is to sort of be looking and constantly monitoring behavior, like you're saying, to look for changes in that behavior. And that's why dog trainers are so obsessed with tracking behaviors. If you ever have behavior problems, likely your dog trainer will say, okay, keep a log of every time the dog does this, or for example, and so we can get actual data on it. And all of these things I think absolutely correlate from a behavior perspective as well. And whenever we see dogs that come in to our practice for aggression, fear, any sort of maladaptive nervous system response, essentially. Sometimes I just see dogs that get way too excited for no reason and can't calm down. And I'm like immediately going straight to the physiological and asking those questions and making sure that we check before just saying that it's a behavior problem in and of itself. We always have to make sure that we're kind of checking all those boxes. And I think this first point here really speaks to your example of like the new rescue dog. And I love that you brought up age, because that is a big thing. I find people say like, oh, my dog's an adult, just an adult, or an adolescent, or just 2 years old, they shouldn't be in pain. The studies and some of the research that we're seeing is that actually even young dogs can be experiencing musculoskeletal pain, as well as dental, gastrointestinal, skin, etc. We might think of that as being only an older kind of animal's problem, but it definitely isn't. So if I'm seeing even a young dog that is behaviors changing, or that's just not making progress and we don't know why, or frequently regressing, coming back again and again and again with the same problems, that's when I really put my foot down and I'm like, we have to make sure that there's something going on here, which was the case with the dog with it was one of our trainers who had been doing all these leash walking exercises and none of them was working, and we were like, there has to be something else going on to figure that out. And I guess that's what this quote is all about, isn't it?
Right. Yeah. Well, there was the case study of the dog that was the rock eater, which is, it's really interesting. And I think it's really kind of instructive, because there was a dog who was eating rocks, obsessively eating rocks, and it had multiple surgeries to have rocks removed. And, a lot of times you think, okay, like the dog's just insane, the dog, whatever, he's just eating rocks. That's obviously not normal. But luckily, I think the team who was working with him went further and they looked more. And initially they took biopsies of his stomach to see if there was inflammation, which they treated, and it had no change on his behavior. He continued to eat those rocks. And then they ended up taking x-rays of his hips and saw that he had hip dysplasia. His hips were, he had arthritis in his hips and were painful. And they started treating him for joint disease, and it completely got rid of the problem. And that's that's an amazing thing to me, because you certainly don't expect that type of pain to result in, you can't even explain to yourself how that could help. Like, how is eating rocks going to help you with your hip problem? But, I think it's really interesting, because it does show you just how unusual it can present. But if you're looking close enough, then hopefully you'll be able to find something that you can then address.
Yeah, I really love that, and that story for exactly that reason. It's like there was a problem with the system over here, and there was a red light flashing way over here, and it takes a detective to put those two things together, which is why having this information is so important. And then from a behavior perspective, I very frequently see dogs around, now that I'm obsessed with pain. I've been looking into movement patterns and how dogs walk and how to tell through their gaits and the way they stand and all this stuff. And so now I'm walking around the city seeing all these dogs, training with their owners. and they are, trying to get them to perform behaviors. Maybe they even have, like a prong collar or a choke chain on them or something like this. And I'm seeing them try to solve behavior problems, and it's not working, and they're having to escalate force because it's not working. And that's because they're missing this huge, and I feel like shouting, I'm like, it looks like their ankles are sore, and that's why they're not sitting at the crosswalk. But that's, I think, this quote here: it's better to treat for suspected pain first, then consider its significance only when the animal does not respond to behavior therapy. And I see so frequently we exhaust all behavior therapy and only then we try pain, and we've just messed up the relationship with the animal before they've even had a chance to learn anything. So yeah, absolutely super key. Let's see what gold nuggets we have on. Oh yes, obsessed. So helpful. And I think this is for me, so why I was so excited to have you here, because so frequently I'll see dogs and I'll talk to one of my trainers and they'll say, okay, we've got this case, and I'll immediately go, pain. I feel like this dog is in pain. I feel a pain. I feel like the dog does not, I'm seeing a pattern. And then we always have this question of like, okay, what do we do now? Like, how do we move next? And yeah, so excited to have you dive into that question a little bit for us today.
And so, for me, the question is, if you suspect that your dog is in pain, then what do you do? And all, the questions that kept coming up is, how do I be the best advocate for my dog? And so, and that to me is a really important question. And a big part of it is just being informed. And so the fact that people are actually watching this webinar, that's a first amazing step to me. Just that you're taking the time out on a busy Sunday to sit down and watch something like this to make yourself more aware. That's like the first most important step, that you care enough to learn more about it so that you can be informed. And then, the next thing that I feel like, of course, as a vet, something that's so important is to find a vet that you work well with. And that, I think, is not always an easy thing, but what you want is somebody that you can have discussions with, that you can partner with, so that you can come up with a plan together. Not necessarily that you're working with somebody who's going to tell you, that you're crazy or that, everything is fine, but somebody that you can actually have a discussion with and make a plan together with, somebody who will listen to what you have to say and then be able to, jump in and make recommendations. And so it's not necessarily that you want a doctor that knows everything. You really want a doctor who is comfortable saying, okay, I don't know everything, but I'm happy to find out. Is so important. And the other thing too is having a relationship with your vet. For me, the most rewarding interactions I have are those long-term patients that I've had, that I can see over time, and I can see how things have changed over time. And so sometimes it's kind of interesting. I have a little patient who I've been seeing him for, like 7 years now. And when he comes in, I see changes that the owners don't necessarily see because they see him every day. And there are things that I've seen that I'll say, oh, have you noticed this? Maybe we should talk about starting supplements for him or getting him on a pain regimen, things like that. So having a doctor who really knows what your goals are, but also knows your animal, makes a huge difference. And so to me, that's a really important foundation. And then if there is the suspicion for pain, and actually this is true too, just for behavior issues in general, making sure that your animal is getting a really thorough exam, that you're doing the blood work to make sure that there's nothing that's being missed systemically. And, if it seems like there could potentially be musculoskeletal pain, making sure that you're doing x-rays or imaging. Sometimes referral to a specialist is needed, but just doing the full workup and making sure that you're not missing anything obvious. And then one of the things, sorry, I have fruit flies. Then one of the things is, if you're at home, so this is something that we had talked about before, it's not uncommon if an animal is painful, an animal will be limping. And as soon as an owner brings them in, they stop limping when I see them. And that's often, just this little adrenaline effect that animals have when they come in. They don't necessarily love the vet, which, is understandable. because it's all of the attention is on them in a way that they're not necessarily always comfortable with. And so that adrenaline can definitely mask something that's going on. But the fact that they're limping means that they're in pain. And so, even though the vet may not necessarily find anything in the exam room, doing all of your due diligence will allow you then to go forward with medications, with a plan to see, like, what are we going to do to see if this is in fact pain and if they're responsive to a pain management program. So the videos help because it's stuff that you will capture at home that we're not necessarily able to see in the exam room. And the more information that you can gather outside of the exam room, the better. So I always ask owners to do that.
Gosh, there's so many things there that I want, so many things that I want to just double down on. Especially, I hadn't even thought of this before, about this long-term relationship with a veterinarian. Like, I definitely, when you mentioned to me, finding a veterinarian that you feel good about and work well with, I was like, yes, of course. I didn't even think about this, how you must be seeing the dog every year, and you can immediately, if the weight has shifted in the way they're standing, or if they're not taking the treat like they used to, you'll immediately know those things. And that's so cool. I'm just like, that really blew my mind there. So I think that's so important and so true, that you feel like you have a vet who you have a relationship with, that vet where you can bring them questions and have them take you seriously. I think that's so important. There are some folks who don't have that experience because they've just moved, for example. And in that case, sometimes I will be counseling guardians to go to a second, maybe even third, get a second opinion, get a third opinion, for example, and see how things go. Because, for example, with our dog Emily, we had to go to 2 or 3 vets before somebody diagnosed the luxating patella, and they would get her to walk and feel her, and she was so tense.
Right. Yes.
1 second, there's a dog just squeaking a toy outside, and I'm just going to ask to stop with them. Apologies about that. That was my staff. That would have gone on for half an hour had I not taken that toy. I don't know where he got that from. Thank you for pause there. Sorry, I can just cut that little section out of the recording, but just to reiterate that sometimes we do have to go to get different opinions, go to, like you said, experts. These are all definitely things that can be done, and videos are huge. So I often suspect pain, physiological pain, like musculoskeletal, like you mentioned, difficulty getting up or reluctant to get up. And I'll always ask clients to send me videos of the dog getting up from laying down, getting on the couch, getting off the couch, all sorts of different things to kind of get that footage. Because when they get in the vet office, it's like, when your technology doesn't work and then someone comes to fix it and it immediately starts working again. It's the same thing. So yeah, definitely. And once we are able to do those integrative, those tests and get that good relationship with the vet and kind of figure those things out, we then get to this big topic of treating pain and what the next steps would be, I guess. Right. And I'm gonna pass over to you. This dog looks like my dog, to tell us a little bit about the medical perspective here.
From the medical perspective, you definitely want to make sure that you're addressing any underlying issues. And so, the really common things that we see are dogs with allergies, with food sensitivities, with dental disease, like we were saying before. And so just making sure that those things are addressed. And I can't really overemphasize just the importance of the skin health. We see so many dogs with low grade and high grade allergies that are really just not addressed. And so that chronic itching. So in case people don't know what they should be looking for, foot licking is one of the more common signs. chronic ear infections that can be from allergies. Anything that's going to make you constantly, your skin constantly crawl is something that you want to be able to address. And so those types of treatments can be somewhat involved. And so it's important to be aware that it's something that requires long-term management. So allergies are not typically something that you can cure. You really just have to manage. So just working with your vet to make sure that you're taking all the steps necessary so that those issues are addressed. Gastrointestinal disease is also really common. So just making sure there are no parasites and that the food that they're on agrees with them. That's not always the case. And gastrointestinal issues can be subtle. And so it's not always that they have vomiting and diarrhea. Sometimes it can be something like gastric reflux. And so just making sure that all of those things are addressed, doing the dentals on a regular basis. The dentals, I have to say, it's kind of surprising to me how often we see disease when they are anesthetized and we're doing our full exams and taking x-rays. Little dogs tend to be a little bit more susceptible to dental disease. There are certain breeds, so Yorkies, Schnauzers, the bigger dogs like the Greyhounds have terrible mouths, Whippets have terrible mouths. There are certain dogs that just really have bad teeth. And so starting early on making sure that you're doing good dental care, because that stuff can really, it can be pernicious. You don't really necessarily see that it's there. So start with making sure that all the other stuff is taken care of. And then if you want to go to the next slide, once you've done that, then it's a matter of doing pain management. So let's say all of the other stuff is taken care of. And if you think there's an orthopedic issue, then there are non-pharmacological things that you can do. And again, talking about things with your vet, but even easy things that you can do at home. So making sure that your pet is exactly the weight that it should be. So with musculoskeletal disease, with degenerative joint disease, when there's arthritis, weight in ideal weight makes a huge difference. And it's kind of surprising. My own brother's dog, she ruptured her ACL, and whenever her weight goes up, she definitely feels it. And when he can keep her to an ideal slim weight, it makes all the difference in the world. So don't discount something like that. Things like non-slip floors, soft beds. Physical therapy is actually a really good place to actually get a thorough diagnosis in some cases. So if you have a really good physical therapist, as a general practitioner, I have a sense of what should be going on, but not as much as an orthopedic surgeon or even like a physical therapist who is looking at like all the little muscles that are basically the support structure for the back and the hips and the legs. And they can often pinpoint the specific sites that are really tense or really taut, and then specifically work on strengthening those muscles. So physical therapy is a great way to go. Acupuncture has been shown to be very effective, laser therapy. And then of course the over-the-counter like joint supplements, fatty acids, all of that should definitely be used whenever there is any kind of concern for orthopedic pain. And then I think the thing that people want to know more about are the pharmacological options. So the oral medications that you can do. And this is not something that's written in stone. And I think it's something that's still being discussed, but doing a pain management trial can mean being on oral pain medications. And there are a lot of different medications that are available. I've only listed two of the more common ones, the things that you're going to probably see the most. And so NSAIDs, that's a group of drugs, the non-steroidal anti-inflammatory drugs. These are like the aspirin type medications, but they're specific for dogs. So make sure that you're not actually using aspirin. Don't use any over-the-counter human non-steroidal anti-inflammatories. You really should work with your vet to make sure that they're on a canine specific NSAID. But those to me are the most effective for orthopedic pain because they do have such great analgesic effects and anti-inflammatory effects, but your dog has to be the right candidate for it. So this is why the blood work The lab work is so important, making sure that they don't have any issues with their liver, their kidney, that they're staying hydrated. So these medications can be used long-term and safely, but you have to do it right. You can't just throw those to any animal. The animal has to be the right candidate for it. But non-steroidal anti-inflammatories are definitely a great option. And then one of the other medications that is used in so many cases is gabapentin. And so gabapentin it's actually an anticonvulsant, but it's also a pain medication and is a great pain medication for nerve pain. And one of the excellent side effects of it, I don't know if it's excellent, I think it's excellent, is that it also has some sedative effects. And so when you're trying to keep an animal relatively quiet, then we use it actually a lot for anxiety. I don't know if you're familiar with gabapentin. I kind of feel like in some cases it really can be a little bit of a miracle drug because you can use it for so many things and it's so safe with so many other medications. So you can use it in conjunction with your non-steroidals. You can use it with your anti-anxiety medications to actually give a synergistic effect with the anxiety medications. And for animals that are not great candidates for the non-steroidals, that is actually a good option. So for animals that are a little bit more debilitated, gabapentin works really well. Like I said, there are other medications, but those are probably the two main ones. And, in my mind, if there's a question about whether there's pain or not, doing something like a 4 to 6 week trial where you're using these medications every day and then seeing how do things go from there, I think is really, really important.
That's so helpful to get that overview, and that's exactly what we did with our dog Emily, with the one who has the luxating patella. And I was talking about this with you yesterday, how we did a trial 4 to 6 weeks and we saw her startle aggression massively reduced to pretty much 0 incidents. And then there was a mix up with the pharmacy and we didn't get the medication for a week, so we accidentally went off for a week before going back on, and everything came back immediately. And we were like, wow, that is night and day. And absolutely night and day. I noticed like the obvious behavioral changes, but then also more subtle changes. The way she moved was different. She didn't hold her muscles as tight, and I didn't notice any of those small things. I just noticed the big behavior. So I think her story is a really good example of missing those subtle signs, but having to go to really advocating for her and saying, no, I really believe that there's something wrong here. Finding a vet that was really amazing and helpful, and then getting that treatment in place in a way that really proves that she needed it. And I love the options of the non-pharmacological routes as well, because it is going to be like an integrative treatment plan for it kind of pain will express in many different ways. I think what we're seeing from this is that they will be treating it in a very integrative way as well.
And I see that on the comments in the chat, somebody asked the question, can you use gabapentin long-term? And you can actually use both non-steroidals and gabapentin long-term with monitoring. And so it is really important that you're doing follow-ups with your vet. You're making sure that the blood work is good, that there's not any impact on the kidneys and the liver. I have to say gabapentin is really, really safe. And I've definitely seen animals on it for, long-term use. The ideal would be that if you have your animals on these medications for longer periods of time, the blood concentrations of them will hit a certain level where you can actually start decreasing the dosing. And so you can get to the point where you're not using these every day, but maybe using them every other day or some combination just to decrease their overall the administration of them, but they can continue to do incredibly well. And so it definitely can be life-changing.
Yeah, and I think we've also touched upon this before privately, like the reluctance that can sometimes happen with folks who when we're presenting medications for dogs, especially and actual pills and prescriptions, people can get quite turned off, especially the idea of using it longer term. Yes. But pain management is, I think, a part of every animal's life to some degree or another, and it's totally normal. I think it should be normalized, and I think that's why it's so helpful to have this webinar to actually say it's safe, it's normal, and there are so many other negative side effects to long-term chronic pain that we already discussed. Absolutely. The physiological changes, the behavioral changes, and how that impacts welfare. That, you know, it's key that we get them the treatment that they need.
Absolutely, yeah.
And I love the focus here on the follow-ups as well, and making sure that they're getting regular check-ins with the doctor, doing your blood work, making sure that it's sitting with the dog well, because the last thing we want to do is create another problem in the treatment.
Right.
And yeah, some of these things like the non-slip floors and stuff really speak to me. I give the recommendation a lot, especially for muscular skeletal pain. And from a behavior perspective, there are also like things we can do to help with the management of pain. I really, when I get clients, if I either suspect pain from the offset with a new client, or if I suspect the development of pain with a current client, I am quite strict that I will not do therapy with this dog until I know that it's not in pain, until I have some idea or you're managing the pain at least, because there's nothing worse than feeling sick or sore and then having someone try to get you to face your fear or talk about something that really upsets you, and likely you're just going to make it worse. So when we do have suspecting pain, I put a really strong focus with my clients on meeting their needs and stress management over training and teaching them new things. I definitely don't want to be trying to get them to do dynamic training exercises like sits or downs even. Imagine if you had like a sore hip and someone was like, sit, okay, now lie down, okay, now sit again, okay, now stand up. You'd be like, I hate you, what are you doing? Just give me my pie, you know, like give me my dinner. So I stop making sure that we're stopping with all of those things. And lots of training recommendations involve asking dogs to do a lot of sitting and a lot of laying down, and often breaking out of that habit is really key at the beginning, because it can really mess up a relationship. One of the biggest red flags for me is handling related aggression and sensitivity. So immediately when I suspect pain, I will tell all clients to, you know, your dog might have loved it when you picked them up like a baby and kissed them on the face, but right now they are, you know, really sore or feeling really nauseous. And they likely will really not like that now, and especially with houses that have kids or other animals. I'll always be mindful about how to manage and keep the sicker or painful animal safe and feeling comfortable. So a safe space to rest. That can be crates or baby pens or a room or something like that. When my dog is feeling unwell, he gets to stay with me next to me. He gets a special spot with mum. But from a training perspective, I think so frequently I get people coming to me saying, I have a behavior problem and I want to fix it. And my job is very frequently saying, no, you can't touch that behavior problem for a while. We need to make sure that we give the dog the 6 to 8 weeks for the pain medications to onboard. We need to do the bloods, we need to do this, so we need to slow down. And I don't train any training around like strangers or dogs for stranger or dog aggressive dogs. I won't do separation anxiety training. I will just wait, and that can be really challenging for folks. We often want to get it done, but it's just not the time to push them, I think, from my experience. And it's also just not fair on the animal from like an ethical standpoint to expect them to change their behavior when their basic needs for safety and comfort aren't being met. And then from a behavior perspective as well, often pain will exacerbate behavior conditions. So for some of my clients, that often means that it's very difficult to manage on a day-to-day basis. Maybe it's unsafe from a behavioral perspective, like the dog is performing aggression that is unsafe, or pardon me, is suddenly unable to be left alone, and so is, you know, chewing the bars of its crate or ripping down, you know, furniture. So sometimes we're talking about medications that will help manage the pain, and we're also thinking about medications that will help manage the anxiety or the increased anxiety that dog is going to be feeling from both the day-to-day stress of existing with chronic pain and also from any medical procedures that might now need to be performed.
Right.
So Right? So I have my poodle struggles with his physical pain is a lot largely to do with as a poodle's skin and ears. Having to make sure that I keep him in really good condition, and he does get ear infections if I don't really keep him very clean and very well groomed. And when he does have flare-ups, I have to administer ear drops twice a day, clean out painful orifices. That's really stressful. So stress management and talking to your medical professional in conjunction with your behavior professional about the management plan is going to be really, really important. And for me, when I see dogs that are struggling with pain, I am very pro advocating, if they're struggling with their behavior, advocating to giving them the medical treatment needed for the behavior and condition, as well as the medical kind of side of things, because it can be so challenging otherwise for guardians and dogs. So those are the things that I'm really thinking about. I'm thinking about meeting their needs, making sure I'm not asking too much of them in terms of movement or touch, giving them safe space. And if they are really struggling, not getting sleep, struggling with anxiety or triggers, talking to a vet about medications for those anxieties while the treatment is in place. Again, might not be long-term, might just be short-term. But I feel like we've touched upon so much. We're just over an hour, so we probably should be thinking about finishing up. Does anyone else have any questions that they wanted to pose to either of us, I guess, the team, before we finish up today? I've had a really lovely time chatting, Dr. Rendon. Is there anything that you kind of want to add in there? I see some questions coming in.
There was actually a question I had meant to answer this there was a question on the sign-up sheet. Somebody had a question about how can you tell whether panting is normal or if it's pain, which I think is actually a question I get not infrequently, because it can be hard if you're not really sure what you're looking for. And so panting is, it's definitely can be subtle, but generally you have to look at it within a context. So has the animal been exercising recently? Is the animal excited? Is it really hot? Like those types of things, that would be normal for panting. Sometimes panting is just happiness. Sometimes it can be just excitement and happiness. And for normal panting, it should be relatively, discreet. You're having just little episodes under normal circumstances. It's not happening all day, and it's not happening every day throughout the day. And so there are definitely medical conditions that can cause panting. So there's something called Cushing's disease that you will see an increase in panting for, and it can be an indication of pain. And so if there is a change in your animal's panting, then I would definitely talk to your vet about it and just make sure that there's not something else that's going on.
Yeah, behavior, like those little behaviors, like panting, for example, can be a challenging one for guardians. You see them so frequently in other contexts where it's safe. It's totally fine, right? It's totally normal to pant if you're hot as a dog. It's totally normal to be panting after meeting someone that you really love and having an excited greeting, panting for seconds or so and then moving on. I'm going to go from a behavior perspective and say, track it. Let's track it. Let's get some data on this.
Yep.
Yeah, so helpful to start tracking it. So just keep notes on your phone. If you are concerned, it might be because, maybe in the evening after a long walk, your dog is laying down and just starts panting for no reason, and it's heavy breathing or something. You can track that on your phone, take a video, and then wait until the next time it's triggered again, make a note, take the video next, just to gain some data on that. And then you could then take that video to your vet and to your behavior professional, and they can say, oh, I also notice wide eyes, or I notice they're holding their head funny or something like that. And then we can go from there. Such a good question. And then we have a few more questions which I think are worth mentioning. This is a good one from Jessie saying, how do you tell if behavior changes are a result of pain or a result of a dog's sort of normal development through a teenage phase, through like adolescence? And we know that dogs, just for some context, dogs will be kind of an adolescent between the ages of 6 months and 3 to 4 years, right? Depending on the breed. And there can be a lot of change over that period, just like with with humans. What would you think to that? I'm kind of trying to figure out what my answer is to that question. It's a good one.
Yeah. It's funny because I kind of feel like that teenage phase, I don't typically hear people telling me that their animal, that the personality has changed in a big way. It may be just that their training has backslid a little bit. You know, they may have a little bit of peeing in the house, and that's not uncommon. And as long as they go back to their house training techniques, then they can often get them back on track. Sometimes it's just a little bit more stubbornness. And so those types of things, I kind of feel like, okay, they're just going through this little phase where they're kind of testing you and they're pushing you. And so if they're responsive to your standard training, then I feel like it really is just a teenage phase. If it's if it's kind of a surprising change in personality. So if you are seeing like an aggression that you wouldn't normally see, or an anxiety and a hiding, you know, those are the types of things that I feel like really should be addressed. You know, whether that means doing a full workup to see if there is an underlying painful condition. I think that's important, because that's also when dogs, for example, can start to really show signs of degenerative joint disease, you know, for the dogs that will develop those early. And so just making sure that that's not a problem. And, you know, like you said, you recommend working with medical professionals. And I always recommend working with a behaviorist, you know, a trainer who is certified, somebody who really knows what they're doing, not just, you know, the kid around the corner who's walking your dog. You really want somebody who knows how to give you good advice and what to do with your pet to see if you can work with that behavior.
Yeah, I totally agree. And I like that distinction between, like, if you had a puppy that was always a little bit aloof, and then they hit adolescence and they are now maybe barking at strangers because that they're now entering at that stage where that's not as unusual, that kind of makes sense, doesn't it? But if you had a puppy that was the friendliest, happiest puppy in the world, and overnight it has become very growly, and you have no real reason, there's no traumatic event, there's no anything that explains it, we will always be thinking medical, even with dogs, like you mentioned, up to a year old or even younger, because like you said, that's often actually when we do start seeing physiological things becoming more important. You know, like the joint pain, GI stuff, allergies, all of these things can start to come up by that age. But I think that's a really good kind of example of why a professional is so important, and a team of professionals is so important, because if you're with your adolescent every day, day in, day out, you won't be able to see those patterns that, like you mentioned, Dr. Rendon, you could see when someone comes into your office. I'm the same with my clients. Like, they come to me every few weeks or a month, or they go away for a few months and they come back, and I'm like, oh, okay, I see a lot of change all of a sudden where they didn't see it just because of the contrast. So definitely something like hammers that point home. And then I think we'll take one last question, and we'll probably go and let Dr. Rendon have your Sunday free again. This is an interesting one about eating and GI. So Emma's saying, I'm a dog boarder and I have a few dogs that the owners will describe as picky eaters, and they allow them to graze. Would you be thinking about this as an allergy issue or a potential red flag for pain and discomfort? What are your thoughts on like picky eaters?
Picky eaters are hard. They're probably hard for you too, in terms of being able to train them. It's really challenging. But for somebody who's a dog boarder, I imagine it's a little nerve-wracking, because dogs won't eat just because they're nervous. They're in a new situation. And so that can impact their appetite. But I definitely see, you know, a percentage of dogs, a relatively small, but, you know, a percentage of dogs that are picky eaters. And it's not uncommon for them to miss a meal, you know, not eat for 24 hours, but still be okay. And they tend to keep their weight really nice and lean. They don't have any other gastrointestinal signs, so their stools will be normal. They're not vomiting. Owners can try switching diets to see if there's a diet that is more appealing. But every now and then you'll just have these dogs that are really not big eaters. I really don't worry about it too much, as long as their weight is appropriate and staying stable. And so I think it's funny to me, because I think it actually, what we see more often than not, are these dogs that are picky eaters, that owners are, everybody becomes, you know, like the Jewish grandmother. They're like, oh my God, you have to feed them. You just put cheese on their food. You put, you know, all the things on their food. And then those dogs come in fat. And it's always really funny to me because I'll see these fat dogs and the owners will say, oh no, they're a picky eater, but they're fat. So making them eat when they're not hungry. And obviously that's a problem. So I don't tend to think of it as generally a problem if the animal is otherwise fine, but I can see as, you know, if you're boarding animals, that would be a little, it could be a little nerve wracking because it could be because they're nervous, in which case I would say really you should be monitoring their weight while they're in boarding. And if you're seeing that their weight is going down, then you may, you know, want to have something as a backup to top the food with so that they're eating when they're in boarding.
Yeah, that I'm so glad that you said that. I see a really similar trend, and my own mother is in the audience, and I point my finger at you, Mum, because they did this they did this to their dog, where
it's so common.
Yeah, it's so common where the dog is a perfect weight, a lovely slim, maybe even not even that, maybe even a little bit overweight, you know. But we have this idea that a dog should eat everything that we give it the second that we give it to them, and when they don't, we'll then start to up the value. Oh, what about this? What if I slather it in cheese? What if I put cream on it? What if I do this? You know, and then we get a tubby dog that now won't eat anything but chicken soaked in ice cream, and that's a problem.
Exactly.
Yeah, I totally agree with you there. Obviously we'll look if there's an underlying GI thing, then that will have to be addressed, but I do see a lot of time picky eaters, and I'm like, you are a feeder. I see you. We have a feeding guardian. We actually have a PDF all about this because it's such a problem. Which is quite funny.
Very common, very common.
So common. Oh my God, my mum's in the chat. I own up. We even hand feed him. His ideal weight. Okay, that's fine. I love that. Well, listen, we've been here for an hour and 15 minutes, so we should probably finish up, but it's been so lovely. I've got a pretty slide. There you go. It's been honestly so lovely, Dr. Rendon, having you here, and people in the chat saying thank you so much for giving up your Sunday. I totally agree. This has been so helpful. I know loads of our guardians and community members are going to watch this and just breathe a sigh of relief, knowing that they're doing the right thing, and that if they had any intuition about needing to do some investigations, they know what they need to do next. So really, thank you so much. And everyone's in the chat saying thank you.
And thank everybody. Thanks for watching. Thank you for inviting me. It's been really a pleasure.
It's been so lovely. Yeah,
I hope we can do something again in the future.
Absolutely. This feels just like hanging out. It's not like work, so I'm happy to get it back. Another one in the schedule. If anyone has any topics that they'd like us to talk about in the future, let us know. And Dr. Rendon, honestly, thank you so much. Have a lovely day, and everyone who joined us, thank you so much. We'll be sending through slides and links and everything later on. And give your pups a big kiss from me. All right. Okay. Thank you, everybody. Bye. Bye, Mom.